Okay, imagine this for a second. You walk into your doctor's office and bam, instant diagnosis. Your doctor just pulls everything, your health records, genetic profile, data from your watch maybe, and tells you exactly what's going on. That's kind of the big dream of AI in healthcare, right? But well, there's the promise, and then there's where we actually are today. So let's unpack this. We're diving into an article by Turgay Ayer from The Conversation, which was recently up on PBS NewsHour. It really gets into the potential, but also the hurdles. I mean, the vision the article lays out is pretty incredible. AI instantly pulling together all that health data for like super fast diagnoses. And they're talking about potentially saving hundreds of thousands, maybe even millions of lives. That's huge. And here's where it gets really interesting. There's this 2023 study mentioned. It says the healthcare industry could save, get this, up to $360 billion a year with major AI use. That's a massive economic push, isn't it? Especially when you think about healthcare costs globally.
It really is. And what's so compelling is how AI is naturally good at finding patterns. I mean, spotting things across millions of patient records that no single human doctor could ever possibly see. Think about catching cancer earlier or finding the best treatment specifically for you based on data from tons of similar cases. It promises faster, more accurate diagnoses, much more personalized care. And it's not just about diagnosis. There's also the promise for hospitals themselves. Making things run smoother. AI can analyze workflows, figure out staffing needs, schedule surgeries more efficiently, basically taking admin work off people's plates, which ultimately frees up doctors and nurses to spend more time actually, with patients, focusing on the human side of care.
Right, okay. So if it's that good, why isn't this future like already here? We see AI everywhere else, phones, cars, whatever, but healthcare seems slower. Turgay Ayer's article brings this up. Cites a 2024 American Medical Association survey says 66% of US doctors use some AI, but mostly for paperwork or, low risk stuff, not really revolutionizing diagnoses just yet.
Okay.
So what does this all mean? What's the holdup?
Yeah, that's the core question AIR tackles. And it's complex. There are technical limits, but also big practical, ethical concerns. This raises an important question
Mm-hmm.
about trust, really. Okay, technically, one issue is something called algorithmic drift. An AI might work great in the lab on clean data, but then you put it in a real hospital with messy, diverse patient situations. Its accuracy can just drop off. It's not used to the chaos, so to speak.
So the real world isn't as neat as the training data. Makes sense. That could lead to mistakes.
It's exactly. Big mistakes, potentially. And linked to that, if the data used to train the AI isn't diverse enough, doesn't represent everyone equally, then the AI can end up giving bad advice or biased recommendations for certain racial or ethnic groups. That's a huge problem. Then you've got the practical stuff. Integrating these complex AI systems into existing hospital workflows, it's disruptive. Hospitals might not have the time, the trained staff, the money, or sometimes, honestly, just the willingness to shake things up that much. It's a massive undertaking. And there's the black box issue. Some AI systems are really good at giving an answer, but they can't explain why. Doctors need to justify their decisions. So an AI saying, "Trust me," doesn't really fly. It also makes getting regulatory approval much harder.
Right, you need to understand the reasoning.
Precisely. And then, of course, data privacy. AI needs tons of patient data to learn. That immediately brings up worries about data breaches, misuse. You have regulations like APA in the U.S. designed to protect health info. So you need super robust safeguards. It's non-negotiable. And finally, sometimes the hype gets ahead of reality. AI gets painted as this magic wand, leading to disappointment when it doesn't instantly fix everything.
Okay, so lots of hurdles. Given all that, where are we seeing AI actually being used now, even with these challenges?
Yeah, it's not all stalled. We are seeing progress, just more incremental. The article points to admin tasks adopting AI pretty quickly. Like AI scribes, over 20% of doctors are apparently using them now. They listen to patient visits and draft the clinical notes. That cuts down paperwork massively. And AI chatbots for things like scheduling appointments, basic patient questions, even translating languages in real time. That stuff is becoming common. In the clinical space, it's a bit more cautious. AI is being used as a sort of second pair of eyes for radiologists, helping them spot subtle things on scans. But, doctors are still hesitant to let the machine make the final call. Only about 12% are really relying on AI for direct diagnostic help, according to the article. So the takeaway from Ayer's piece is that this transition is going to be step-by-step. Short-term practical gains are winning out over those big long-term transformations for now.
So quite a journey from these huge, almost sci-fi promises of AI in healthcare down to the current reality, which is, well, more about steady progress and tackling some really significant roadblocks.
Exactly.
Yeah.
Turgay Ayer's article, again, from The Conversation on PBS NewsHour, really highlights that balance. The potential to, as he puts it, treat millions and save trillions awaits definitely, but getting there, it's going to take time, a lot of careful testing, and really working through these complex technical and practical issues.
It definitely gives you a lot to think about. So as you reflect on this deep dive, maybe consider this. What single piece of this AI puzzle in healthcare do you think needs to click into place first for things to really take off? What's the most critical key to unlocking that future?